Hello, this is Michael Pepe. I am the Director of Solutions Engineering at Cinzy. I appreciate everyone taking the time today to learn about our solution. Our platform allows staff members, patients, family, and community physicians outside of your organization all to communicate virtually to improve the quality of care and patient experience. Our platform is device agnostic, so staff, patients, and family members can use any device they are comfortable with. We are one of the best in the industry in managing patients with complex chronic conditions. We are truly an all in one comprehensive communications platform that consolidates many methods of communications all in one place. All our communication modalities within Cinzy are audible and reportable. No personal phone numbers and emails are ever shared. Today, we are going to cover our remote patient monitoring and assessment tool. This session will help you predict, manage, and improve outcomes for your patients. I will highlight how to gather remote patient data on key vital signs and set up intervention workflows to address non-compliant situations. The clinician and patient are able to conduct a virtual visit, secure message, text, email, automated programs, assessments, and remote patient monitoring all on the same platform. Cinzy's remote patient monitoring tool is the fastest and easiest remote patient monitoring solution to implement. With Cinzy, your patients can easily share their vital signs from a smartphone, tablet with Bluetooth enabled devices, and consumer products. Your staff can monitor weight, temperature, blood pressure, blood oxygen levels, heart rate, and glucose. Our dashboard highlights in real time patient data and triggers alerts when a patient's data is out of a normal range so your team can quickly intervene. Your referral partners can also continue tracking health data for a patient who has been released to one's home or nursing facility. Within Cinzy's virtual care platform, as a staff member or clinician, I can view my roster of patients I have access to. Within the patient profile resides all of the modalities of communication in one area. For on-demand communication, I have access to secure messaging, virtual visits, or simple text or email. Very helpful in non-PHI type of communication or communications with patients who might just have a flip phone or non-smart device. Within the monitoring section, I can view the latest updates on the patient's vitals in real time. In one area, I can view their latest readings for blood pressure, oxygen levels, heart rate, temperature, weight, and glucose. Any abnormal readings out of a preset range will be displayed in yellow for staff members to easily view. This will also generate a push notification alert to whichever device the clinician is logged into as well. Cinzy's patient program management tool is a perfect accompaniment for remote patient monitoring. Patient program management allows automated pre-scheduled messages to be delivered based on the patient preference by either text or email. Cinzy has a content library to choose from existing education, or you can upload your own. As you can see here, this patient is enrolled in a COPD program. This specific program can automatically send medication reminders or education about their specific condition. The Vitals program for this specific patient will send reminders up to 4 times a day to take a specific reading for blood pressure, weight, heart rate, etc. You can customize these based on a patient's specific condition. For instance, if I'm monitoring a group of CHF patients and I wanted them to weigh themselves on their Bluetooth scale every morning at 8 a.m., I can customize a specific program for that and assign it to individual patients. In Cinzy, I can also include caregivers. Caregivers within Cinzy, we use this term very broadly. These can include family members, community physicians, referral sources. You can attach as many caregivers as you'd like to a patient profile. The staff member within your organization has the ability to communicate with these caregivers the same exact way they would with the patient, secure message, virtual visit, text, or email. We see the caregiver method used many different ways across our client base. See it very helpful with hospice patients or maybe patients that are not tech savvy, that a clinician can conduct a virtual visit directly with a family member, or even just in remote care. A clinician can be sitting with the patient, and the patient decides, I want to bring in a family member so they could see myself and the patient together during the visit. But we see it used in many different varieties. We also have the ability to flag a caregiver to receive those same patient program messages that the patient would. So again, if a patient is not that tech savvy, maybe doesn't have a smartphone or a flip phone and can't even receive text or emails, that caregiver can receive those same automated communications on things like medication reminders or reminders about exercise or just more education about their condition instead of the patient. Lastly is our assessment functionality, which is a complex survey tool. This is another method to gather more data about your patient in between visits. Assessments are configurable, can be taken with Cinzy's patient-facing application, which is called Care Connect, or it can be sent to patients via text or email that do not require a patient to download an application. Assessments can be set up to go out on a recurring schedule. So for instance, if you're monitoring a cohort of CHF patients, you can ask them ongoing questions about their condition. Patient responses are fully reportable, as well as the ability to flag responses. For instance, with this specific patient, they recently completed a COVID-19 risk assessment. So within the assessment, you can see here, they responded they have a fever and a cough. These are two responses my organization has flagged. This will create an intervention that you see directly here, where I have the ability to message the patient or resolve it. It will also send an instant push notification to the device of the patient's care team that they have a new alert. Cincy has made available a patient-facing application called Care Connect. The Care Connect application is available on both app stores, Google Play as well as Apple application store. But the patient can also do many of the same functionality without having to download an application, such as a virtual visit or completing an assessment. There is some more robust functionality within the patient-facing application. Once the patient logs in via an access code or date of birth, no username and password required, the patient will be dropped directly into the home screen. Within the home screen, any of those automated pre-scheduled messages from patient program management will also be displayed directly here that they received via text or email, depending upon their preference. Any vital program messages that have been pre-scheduled for this specific remote patient monitoring patient will be listed here, as you can see by the different vital reading reminders. As a patient, they can view any Bluetooth devices they already have paired or connected directly through the application. For this specific instance, I'll show you what it looks like for a patient to take an oxygen level reading through our application. A Bluetooth device needs to be paired for the first time, but once it's paired, they will never need to pair the device again. We also have a direct connection with Apple Health or Google Fit if you're on an Android device. So any third-party device can be paired directly through Apple Health or Google Fit, and those readings can be transmitted into the Care Connect application. For this example, I will just pair my pulse oximeter directly to Bluetooth. And I'm just going to turn on my device. And once it's paired, it'll show up in my available list. So as a patient, I'll receive a text or email up to 4 times a day. I will click on the text or email and it'll bring me right to the Care Connect application where I can take a reading. So I'm going to go ahead and place the finger on my device and I'll let it just turn on for a second here. And once the device is turned on, I will go ahead and select Take Reading. Okay, so any of the vitals will be displayed directly here. And once I have a confirmed reading, I have an oxygen level of 99, I will select confirm reading. For the patient, that vital reading is completed and done. So within the Care Connect application, there is also other functionality. I can have a care team assigned to a specific patient. So think of any high risk patients that you want to give the ability to initiate a virtual visit or secure message to a pre-designated care team that administrators at your organization have selected. These could be individuals, or they could be a nurse, a group of nurses that you see down below under first available. This could be anyone that's on call and logged into the application. Patient also does have a secure messages area. So previous vital readings that I took earlier was outside of an abnormal range, and will show my care team is reviewing my vitals, and it'll be a receipt back to the patient that they successfully submitted a reading. And then the patient can take any assessments assigned. So if you remember earlier, I had a CHF follow-up assessment assigned to this patient. They could take it outside the application just by clicking on the text link or email, or they can take it directly within the Care Connect application. Again, these are all configurable and customizable, so you can word whichever you want within this section. This will explain to the patient what this assessment is for, how long it'll take, and when you need to complete it by. So as a patient, I will select Start Assessment, and I could select from yes, no questions, multiple choice, text boxes, whatever you as an organization have set up within this assessment. We have some branching logic as well built into the assessments. So for instance, if I said, yes, I have weighed myself today, it'll bring me to a what is your weight question. If I say no, I have not weighed myself today, it'll bring me to a different question. Assessments can be set up this way depending upon how a patient answers, bringing them to a different question, or it could just be set up chronologically. So I'm just going to say, yes, I do need assistance with my scale. And I'm going to choose from a multiple choice question. So I'm just going to say I would like someone to contact me 9 a.m. to 12 p.m. And then as a patient, the assessment's complete. I'm going to go ahead and hit yes. And this will then submit the assessment over to my profile where any interventions will be generated. And then any administrators or directors within the next section that we're going to cover, which is our enterprise admin tool, will be able to pull full reports off of assessments and responses as well. In Synzi's enterprise administration, pre-designated administrators who have the rights and the ability can manage the entire platform. You have the ability to manage all the enterprise settings, control and manage users, deactivate and activate users, as well as control patients, clinical content, assessments, and our full reporting tool. Within Enterprise Admin, there are a variety of reports. For example, a detailed contact report will give you full access and transparency into all the activity going on within the platform. If you ever need any sort of audit trail for video visits that took place, the start, end time, participants, everything is date and time stamped, as well as all the text and emails out of the platform. Regarding remote monitoring, you are initially dropped into a dashboard. You can view all the readings taken today for your entire patient population that have Bluetooth connected devices, as well as see any patients that missed readings within one area. You also have a dashboard view on the monthly activity. You can see all patients that are enrolled in any of those automated remote monitoring programs, see any interventions generated, see any of the interventions that have been resolved. So you could see utilization by your staff and efficiency on how quickly they are resolving interventions as well, and the average response time. And then you could see how many patients are in compliant or out of compliance. This can really help you monitor patients that have devices connected. Within the dashboard, you can now drill down into specific patients. For instance, patient James Cook here, I have a pre-configured date range to run for a week. I can also choose a date range if I just want to pick out their latest vital readings for the month, quarter, or year, or just choose a custom date range. I will then get an interactive dashboard on each vital reading. If I hover over a specific date, it will give me the value and what the reading is. So on Tuesday, the 29th, James Cook had a heart rate of 65 beats per minute that he logged. If I ever need to export this data out, maybe I'm working with one of those caregivers, a community physician, and a physician might need this report for all the vital readings for this patient, I can download to CSV and I can show the PHI for the specific patient. Or if I'm sending it over on secure email, I can hide the PHI. You also have an interventions dashboard. This is really a command center where administrators, directors can come in on a daily basis, a weekly basis, change the specific date range, and see all patients that have an abnormal reading. They can view what vital reading it was for, what the previous reading is, what their current reading is, and then have your specific message modalities. So instead of having to go back to the virtual care application and look up a specific patient profile, maybe a director of a nursing team or administrator can message James Cook directly from the report. And I can also send it on behalf of another staff member. So if someone's on vacation, or maybe the patient only knows that specific staff member, I can send it on behalf of their nurse. Down in the assessment section on the left-hand side, you saw earlier I had the ability to manually assign an assessment to an individual patient profile. You also have the ability for any assessments that have been created or configured, I can bulk assign them by saving myself time. If I want to specifically assign maybe a COVID-19 risk assessment to my entire patient population, I could just do so by a toggle of a button. I don't need to individually go through each patient profile. Unilaterally, this also works for your staff team. So if I did want to maybe assign a COVID-19 risk assessment, if there's a specific outbreak in my area and I want to assess to see how my staff members are feeling, I could do so just by simply by a click of a button. That assessment will go directly to the staff's virtual care application. They can then complete the assessment and I can run reports off of this. This will also make it easier for staff members that they don't need to log into a separate application. So within the assessment reporting feature, I can run two reports. I can run a report based off of the entire assessment. So if I wanted to see across my entire patient population, everyone that's taken the coronavirus risk assessment, I can see how many people have completed it, how many are incomplete, what the response rate is. And I can see the percentage of responses for each question. Since I have fever, cough, shortness of breath, and difficulty breathing flagged for this specific assessment, a checkbox will appear here. And anyone that responds to this specific question with this response, this will generate an intervention alert. And of course, any of these reports I can download to CSV as well. So if I wanted to drill down into a specific patient, I can do so as well. I can drill down into any interventions here. So these are any flagged responses for that specific patient, and I can view their individual responses. So earlier, a patient back in October, Debbie Brooks, had taken the COVID-19 risk assessment, had been experienced fever, had recently traveled, and they don't wear a mask in public. So I could see their specific responses to the questions. And just like earlier, as you saw in the remote monitoring intervention section, I can resolve it directly from the report, or I also have the ability to message them directly from here. Thank you for everyone's time today. To recap, Cindy, we look to consolidate many methods of communication and technology into one place, really increases employee satisfaction, ease of use for patients. We really strive to remove barriers of entry for most patients to make it easier for them to use this technology and in a cost effective manner. Thank you all for everyone's time today. Please let us know if you have any questions.